Hey guys, what's up? This is Riyadh again. So basically what we have for today is, as we said, we will continue with the valvular heart disease. So this is 35-year female patient. This female, she's basically pregnant and you will see 20 weeks pregnancy. Guys, pregnancy with heart disease, always remember two things. Always remember pregnancy heart. Always remember the first disease will be mitral stenosis. And the second one will be maybe questions about preeclampsia or hypertension. All right. Maybe the third one, kind of peripartum cardiomyopathy. I think this is really a big time for pregnancy. So once you read the questions and you are just on the first line, pregnancy, and you know we are talking about the heart, because at least from the options or at least from my YouTube channel, basically these are the videos we are making just now, the videos for valvular heart disease or for heart disease. So it's pregnancy, she's 20 weeks, and you know all the heart progressive shortness of breath with moderate exercise. Also she had some kind of palpitation, she denies drugs, she denies tobacco abuse. Now he mentioned this two interesting thing, which is basically no heat intolerance or denies weight loss, and basically he tried through this simple sentence, he tried to tell you this is not thyroid. So basically thyroid disease is one of the differential diagnoses here. Now what you will see on physical exam, basically first, it's really important to see if the heart rate regular or not. Why? Because atrial fibrillation is really big times in mitral stenosis. So here he told you regular, and in this case, because he tried to tell you that in this case you rule out atrial fibrillation. Blood pressure 140/90, and heart exam, oops, sorry for that. Heart exam revealed diastolic murmur. Basically, this is the diagnosis here. So he already told you diagnosed diastolic murmur in the mitral area. Now, echocardiography showed mitral valve orifice 0.5, which is really quite narrow orifice. I mean, maybe you don't know the area, but you know, guys, 0.5 is really small. So basically, because of really severe stenosis mitral valve, pulmonary artery pressure is a kind of high. This is a kind of really later consequences, 40 millimeter mercury. And now, what's next? This is a kind of different approach with some diseases, guys. Yeah, sometimes what they will tell you, he will not ask you directly about the question about a disease. He will ask you what are the consequences of the treatment of this disease. And it's really not hard. It's basically the opposite of pathophysiology, or maybe the correction of the pathophysiology. And really, this is a significant approach for step one for some questions. And instead of asking you what is the disease is, or what the diagnosis is, or what is the pathophysiology of the diagnosis, he will ask you what is the pathophysiology if you treat this condition. Basically, this is what I tried through my simple questions. What we did, percutaneous balloon valvuloplasty. So basically, he did valvuloplasty, which is a kind of treatment options other than the valvular. You have repair and you have valvuloplasty, but because it's pregnant, so usually goes valvuloplasty. And after that, which of the following hemodynamic changes would you expect to find after procedures? And hemodynamic physiology, which is basically big times and it's very high yield, and it's really not easy for people to know these are you have all of these options, basically hemodynamic physiology. Now it will be easy for you to get the questions wrong if you didn't read all the questions. Let's say you didn't have time, if you didn't read all the questions, and then in this case you will choose the one that represent the pathophysiology. But again, remember, the idea of the question is after the procedures. So what do you think, which of the following pathophysiological changes that you would expect after you repair mitral valve or you do mitral valvuloplasty? And here you will see different. You will see increased left ventricular peak systolic pressure, left atrial and diastolic pressures. And here basically you have left ventricular and diastolic pressure. Sorry. Yeah, no, sorry, it's not here. Oops, excuse me. Yeah, sorry, I think I made a mistake. Yeah, So basically what you see here, let's go back. What you see here, you will see left ventricular and diastolic pressure, which is a kind of different from left ventricular. This is left ventricular and diastolic pressure, sorry, and this is left ventricular and systolic pressure, guys. This is one of the different, both of them ventricular pressure, but you have left ventricular and systolic pressure, which basically at the end of systole, and left ventricular and diastolic pressure, which is basically at the end of diastole. So in this case, usually you are talking about end of diastole, and left ventricular and systolic pressure are talking about end systole. And the same things for left atrial. So you have left atrial and diastolic pressure, and you have left atrial and systolic pressure. Again, you have also something called total peripheral resistance and increased pulmonary capillary pressure. Now, and the way to answer these questions, you will not be able to answer it without understand each one of them, at least the definition of each one of them, what each one of them represent to you, and then you will just apply what we have to the mitral stenosis. Now, let's start with some explanations. Again, you have, this is the heart, and guys, this is basically the mitral valve, and the mitral valve just closed. Failure to open of mitral valve during diastole. I know this is another tricky. This is the mitral valve closed. You need to open the mitral valve in order for blood to go in, right, inside the heart. So if the mitral valve will not open, so basically will not have filling, so basically will not have diastole. That's why it's diastolic murmur. So maybe it's really easy. So what I will say first, failure to open mitral valve during diastole. Or you can say, which is much easier, failure to open mitral valve for filling. I think this makes sense, really. You need to open the mitral valve for the filling, guys, right? You need to open the mitral valve for filling. So if you will not be able to open mitral valve for filling, that's why in this case you will have mitral stenosis, and that's why the murmur will be diastolic murmur. So again, it's really not so hard. Failure to open, this is the valve again. You will not be able to open the valve for the blood to go inside the left ventricle. So basically that's why you will hear diastolic murmur. So, and I said before, whenever you hear word filling, please, just filling is the same as relaxation, is the same as diastole, is the same as, yeah, I think that's it. It's the same as diastole, is the same as filling, is the same as relaxation. So basically what you have here, because this is not open, now left atrial pressure, and this is pressure usually during what? I just mentioned it, diastole. That's why I will say left atrial maybe, and diastolic pressure will be high. Although the systolic pressure will be high too, but this makes sense because during filling, instead of the blood to go inside the ventricle, I just say it. We just said, you guys just memorize the sentence, and it's really not so hard to understand how to memorize it. Because you will not have the blood to go inside the left ventricle. So basically the left atrial and diastolic pressure will be just high at the end of the diastole, right? At the end of diastole, which is basically at the end of the filling. So left atrial and diastolic pressure will be high. How about left ventricular pressure? Let's assume left ventricular pressure, whether it's systole or diastole. Yeah, because this is really not big deals in whether it's systole or diastole in case of mitral stenosis. What do you think the pressure here? Just think about that a few seconds. It's really not hard also. Just imagine you have a closure here. Once you have a closure, so basically the next compartment will be protected. Or you can say left ventricular pressure in the next compartment will be either normal or maybe low. Usually normal, I like the normal one. Left atrial and diastolic pressure will be high. So that's it, guys. Here you will see the arrow of left ventricular pressure will be normal. Left atrial and diastolic pressure will be high. Any questions so far? I think it's not so hard, right? Now, if you would like to continue the whole equation, I will draw the heart back again, and this is left ventricular pressure. As we agreed, the ventricular pressure will be a kind of normal or little bit low, and left atrial and diastolic pressure will be high. Okay guys, the blood will just back up. Why? Because the pressure will here increase. So that means basically pulmonary venous pressure will be high. Right? So pulmonary venous pressure will be high until it will get inside the lung. And inside the lung, basically you have capillary, something called pulmonary capillary, which pressure also high. So all of that, guys, look at that. All of that will be high. And it's one compartment system, please. Once you will have an increase in left atrial pressures, this is the atria. Once you have an increase in left atria, just the pressure will be back up. Pulmonary venous, pulmonary capillary, which pressure will be just back up to the lung until it will get congestion. And after that, here basically you have something, you have congestion, right? Because of the increased pressure. And it's a kind of also, again, it's one compartment. So by the end, yeah, I will not change the colors. By the end here, the artery that basically supply the lung is pulmonary artery. So here you get pulmonary, right, artery. So in this case also pulmonary artery pressure will be increased. Again, it's just backup. And once the pulmonary artery pressure will be increased, I know maybe it's not so accurate, will be increased. If you go back to the heart, you will see right ventricular pressure. Right ventricle will be also increased. So right ventricular pressure will be also increased. That's why the patient may present as right heart failure. So we started as left atrial problem. It's not left ventricular failure. You start as left atrial problem, then goes back up, pulmonary artery pressure, right ventricular pressure. That means you get, in this case, you will get something called pulmonary or right heart failure. So in this case, the patient will have now, for the first time, you will see edema or jugular venous pressure will be increased. That means it's venous return problem. That means it's right heart problems, right? It's right heart problem. Again, really, it's not so hard. Just imagine you have one compartment. Once you will have an increased pressure on the atrial, the pressure will go back to pulmonary venous, pulmonary capillary, which pressure, pulmonary artery pressure, right ventricular pressure. All that will be increased. That's why right heart failure problem will be at the end. Usually rare, but it will be at the end if it is not treated. So this is the hemodynamic. This part, basically, this part of the hemodynamic for mitral valve stenosis. All right. Now, if you will go back to my question, so basically this is pathophys. If you will go back to my questions, once you will do the surgery, what you will expect? What's the trigger you will expect to be corrected? And I will highlight the green point, I will highlight the green is the after this procedure. So after the procedure, left atrial and diastolic pressure will be decreased. Pulmonary venous pressure will be decreased. Pulmonary capillary, which pressure will be decreased. And pulmonary artery pressure will be decreased. And right ventricular pressure will be improved. Although, by the way, usually pulmonary artery pressure is a kind of irreversible. I mean, guys, once we will have pulmonary hypertension, it's really difficult to correct it. Basically, here, what I mean by pulmonary artery pressure, I mean pulmonary hypertension, by the way. Pulmonary circulation is really it's really sensitive, different circulations. Once you will have, in general, because we will talk about that also in ASD, VSD, any left heart failure problem maybe, not a right heart, so whenever the cause of pulmonary hypertension is, once you will get pulmonary hypertension, it's really a kind of irreversible. So I will say, but if it is a theoretical pathophys, you can say this is decreased, or maybe you can say this is, you can put this irreversible too for some disease. So I don't think he will put this for you, or at least I didn't put that for you because it's a kind of confusion after the procedures. But theoretically, you will assume it's decreased, but it's not significant because it's a kind of irreversible. Now, so after the procedures, here you have the green one. So you can say procedures, which is basically valve repair or plasty, right? You will assume the following changes after the plasty. Again, number one, decrease in left atrial and diastolic pressure because it was high, so it will be decreased. Try to be normal. Left pulmonary venous pressure will be decreased, pulmonary capillary pressure will be decreased, pulmonary artery pressure will be decreased, and maybe correct right ventricular pressure, although these two usually are reversed. How about left ventricular pressure, which is basically here or there? It's just normal, right? And I also highlighted green, and I will make it number 6 here just to tell you this is not normal, and this will not affect it. So that's what we have. Now, if you'll go back to the question, if you'll go back to the questions, you will see left ventricular peak systolic pressure. I told you don't play with the ventricle. So any ventricle, whether here or down the system, which is during systole or during diastole, I don't think it will be really a big answer. So forget it. So you can forget that one. You can't forget this one. Okay? You can easily take this out. Now, an increased left atrial and diastolic pressure, this is a kind of tricky because maybe you will choose that if you will have a disease. If there is no disease, you will not choose that. So basically, this is the answer for mitral stenosis, right? An increased pulmonary capillary pressure. Decreased pulmonary capillary pressure. Maybe that's interesting. This is basically the answer for mitral stenosis repair, and this is basically our answer. Once you will do the repair one or valvuloplasty, right? This is number 3. This is number 3, which is basically the green part. It's down. I told you pulmonary capillary pressure will be, right? This one. Pulmonary capillary pressure will be just decreased. It will be increased as pathophys, but decrease as a procedure. Now, total peripheral resistant. Now, the resistant and afterload is really not a big deal with the mitral. The afterload usually plays a role with aorta. Aortic disease. Again, left ventricular and diastolic, this is the ventricle. And again, guys, also the ventricles plays a role. Usually the ventricles is the answers for aortic diseases. Alright? And finally, we get an increased left atrial and systolic pressure. And I know this is tricky. That's usually the answer for mitral regurg. Guys, you have to study like this again. You have to know each options usually indicate one diagnosis. Usually. Rarely they put destructor, which is sometimes happen. But usually each options means one diagnosis. Once you will understand each options exactly what does that mean by each option, by each choice, you will be fine. So okay, so that's what we have so far. So let me just summarize some other stuff for the hemodynamic. I didn't finish I think I need another lecture maybe for mitral stenosis. I didn't finish it. So basically what I have here, guys, whenever I have, let me see if I will do mitral stenosis, continue mitral stenosis or continue. Let me continue the stenosis better than the hemodynamics. So basically this is the stenosis. This is left ventricular pressure. This is left atrial pressure, and we agree this is during diastole, and this is left ventricular pressure. Guys, whenever this is the pressure will be high, that means left atrial dilatation. And whenever you have left atrial dilatation, basically the atria will compress the esophagus. Right? That's why the patient presented with, any idea? Dysphagia here. And esophagus usually posterior. And basically it's just the direct organs or direct organs after left atrium. Now, because this is also dilation, this could be a source for thrombi. So maybe the patient later on, this thrombi will be emboli, and what I mean by emboli, this is a kind of a stasis, source of thrombi because stasis. Because imagine just the left atrial will be dilated, and here what? Here will be stenosis. And when you have this dilation, basically on stenosis, could be source for stasis. Once you will have a stasis, here will be thrombus. And this is not totally closed because I told you it's 0.5, so maybe part of this thrombus will be just emboli. microemboli, or maybe emboli. I mean, once to emboli from left atrium where to left ventricle, and once we'll go to left ventricle, and I know this is not easy. A lot of people have problem with circulations. This left ventricle, once you will get into left ventricles, what the next will be? The next will be aorta, right? So basically the emboli now, this is the small dot, represent the emboli, goes to the aorta, and from the aorta you have something called internal carotid artery, and from internal carotid artery basically the emboli will just go up, and cerebral artery, and that's why the patient may be presented with paralysis, which is basically, and usually the most common kind of stroke is MCA stroke, which is basically middle cerebral artery stroke, right? This is middle cerebral artery, and usually middle cerebral artery presented as, you know, this artery if it's left side, middle cerebral artery stroke. All right. So basically, this is another complication, which is really high yield of mitral stenosis. Now, plus this dilation is a source for left atrial to become inactive. So maybe, so this dilation sooner or later lead to atrial fibrillation. Very high yield atrial fibrillation cause or a feature in case of mitral stenosis. So far you get 3 diseases. What next? Maybe it's not so high yield, but I told you pulmonary venous pressure will be increased, and because of increased pulmonary venous pressure and pulmonary capillary pressure, this too much pressure maybe will rupture the pulmonary bronchial artery circulations. That's why the patient will have maybe hemoptysis. Alright, these are all features of mitral valve stenosis. Again, it's really not so hard. You have the dysphagia cause because it's compressed the esophagus. You have the emboli cause because of just too much dilation, left atrial. Left atrial dilation will be ineffective. That's why the patient have atrial fibrillations. And also you have the hemoptysis, right? You have the hemoptysis. So basically that's at least what you get from pathophys of mitral stenosis. And again, these are, if we will make it left atrial pressure high, the pulmonary venous pressure high, pulmonary capillary pressure high. And don't forget, guys, when you will go back, basically all of that back will be high, which is pulmonary artery pressure. If you remember in the first slide, I said pulmonary artery pressure high, and then if you divide this, the heart, right ventricular pressure high, and this right ventricular pressure high leads to now another diagnosis, which is basically lower limb edema and ascites. So you'll get edema or jugular venous pressure increase or ascites, which basically we are talking about right heart failure in this case. And you can now make this as another complications of severe mitral valve stenosis, right? So I'm talking again about mitral valve stenosis. The common presentation of mitral valve stenosis in this case, usually you will see young women either pregnant or immigrant, because it's long-term consequences. So mitral stenosis, and in a pregnant, because too much fluid or fluid overload basically exacerbate mitral stenosis. For some reason, I don't think it's really time to mention it here in details. And for immigrant, because we are talking about rheumatic fever. So always remember, rheumatic fever, not usually 10 years after rheumatic fever. Guys, usually you need 20 years. So rheumatic fever, you need history of rheumatic fever. So basically you need around more than 20 years of rheumatic fever in order to get mitral stenosis. Or in a pregnant patient, and you discover melanoma in a pregnant patient is also big times for mitral stenosis. So these are the key points. So in this case, really would be much easy once you know the key point for mitral stenosis, so either pregnant or maybe rheumatic fever, or patient with basically with rheumatic heart disease. So that's what I get so far. But because usually the way we like to do, again, guys, don't study page by page, don't study disease by disease, which usually I don't believe. So I will just do it another differential, which is really nice. So basically here you will have left atrial pressure high, and as I said, left ventricular pressure low or normal, and everything will be high, right? Pulmonary venous pressure will be high, pulmonary capillary pressure will be high, and then the right heart failure. Here usually your answer will be mitral stenosis. Now if you make another differential, I will draw the heart for you. I will draw the mitral valve, it's a kind of normal. I will start with this one. So this is my start point, guys. Left ventricular pressure high, big time. This is the start. But because this is high, left atrial pressure high, pulmonary venous pressure high, and pulmonary capillary which pressure high, and also we'll go back, you will see right heart failure sooner or later. What is the diagnosis here? Now the only way different basically between the first diagram and the second one is you start from the ventricular pressure high. And the reason why you start with the pressure high, maybe you have just too much blood, or I don't know why. Basically, you need to know why, because this is the answer. So basically, the answer for the first diagram will be mitral stenosis. Any idea about left ventricular pressure high start with in the second diagram, and that's why left atrial pressure high, pulmonary venous pressure high. You get my point? So my point is the only difference between these two diagrams, the first one starts from left atrial pressure, while the second diagram starts with left ventricular pressure. So do you get what is the difference? I mean, what is the diagnosis for the second one? Again, the first one just mitral stenosis, the second one is left heart failure. So basically, this is usually the answer for left, for the answer, maybe you can just say for the heart failure, or the answer for left heart failure usually. Right? Left heart failure. In left heart failure, you have decrease in contractility because it's just heart fail. And whenever you have decrease in contractility, that means, whenever you have decrease in contractility, basically, you will have more blood in the left ventricle. Whenever you have more blood in the left ventricle, so basically, pressure will be built up. I will talk about that also in details, but this is a kind of differential, guys. Again, don't study disease by disease. Although maybe you cannot make it in the beginning. You have to say disease by disease. But after that, you will see maybe after 1 or 2 lectures, you have to link them all the valvular heart disease together. We have to link also heart failure together, and also we'll link coronary artery disease together in order to get the diagnosis. So left heart failure usually starts with left ventricular pressure. Now to make it more interesting, how you will treat. What is the trigger in digoxin therapy in left ventricular pressure? Again, I will make it green. Basically, you will decrease left ventricular pressure in digoxin. That's why left atrial pressure decrease. That's why pulmonary venous pressure decrease. That's why pulmonary capillary pressure decrease. So the green one will be digoxin mechanism of action. Look how you make it. It's really fun. So the green one will be just digoxin mechanism of action, or will be the option for if you treat heart failure, what the hemodynamics expect to change. However, again, these are usually a pathophys. I'm not talking about medicine. In medicine, really, it's a kind of different, because of statistics, what it should improve, what it should not improve, which is usually you don't need to know it. But the green one is digoxin action. So digoxin action will start with decreased left ventricular pressure, left atrial pressure, and blah blah blah. While the green one for valvuloplasty, which is basically starts from decreased left atrial pressure and all of that decrease. So this is the start. So this is really significant, funny difference between the two treatment and two pathophysiology at the same time, mitral stenosis or left heart failure. We'll talk more about the others, inshallah, in the next topic. Alright guys, thanks a lot for watching my videos and enjoy your rest of the day. Alright, see you tomorrow.